When I was an amateur back in the UK, I was boxing in some national championships, and I got caught in the eyes, and all my corneas got scratched. So then I had to go to the hospital and had to have all the loose corneal tissue cut away with a needle to allow them to repair. And then when I moved over to Australia, I thought I'm not going to do it anymore. I'm going to stop getting my head punched. And then I started training at a professional gym just for a bit of fitness. Yeah. And then when I was training at the gym, one of the coaches there saw me and said, "Oh, would you like to turn professional?" From when I was about 12. And then when I started boxing competitively, I knew I wanted to have a career that dealt with the human body in ways that we can make it perform and function better. And it was then that I decided I wanted to do something like physio or chiro or massage. When I decided that was what I wanted to do, I started looking into the different professions, and I started shadowing a local chiropractor back in Birmingham. And I saw that patients would crawl in, bent over in pain, and then they'd walk out standing up straight without pain. And that one was like, I was like, that's it, chiropractic's the one for me. And then it wasn't. So then it was then I decided that I was really passionate about chiropractic. I wanted to do it in the future. I want to be an evidence-based chiropractor who gets patients better by practicing the way that research has shown us how to, and basically just get patients better as fast as possible, few smart treatments, let them live a happy and pain-free life for as long as possible. Whereas physiotherapists, they're very similar to the evidence-based chiropractors. So they treat according to the evidence that's available to them. Both professions, if we need to, we utilise imaging to see what type of treatment we need to do, such as X-rays, ultrasounds, MRIs, and both chiropractors and physios do that. In chiropractic, we tend to concern ourselves more with the spine and things associated with the spine, such as the muscles, tendons, ligaments, discs, nerves, whereas physiotherapists tend to concentrate more on the muscles of the body and their correlation, especially with the extremities, such as shoulders, hips, knees, and the rehabilitation of the muscles once they've been damaged almost. Chiropractic, physiotherapy and massage therapists, and we all work together as a team. And we all have our individual thing that we're like a specialist in each area kind of thing. So if I have a patient who comes to me who has a problem that's better suited to the physiotherapist, I'll refer them to the physio. If I have a patient whose problem isn't to do with the spine or the joints and is more muscle, I'll send them to the massage therapist. So we all work together as a bit of a team so we can give the patient the best service possible. These are the orthopaedic tests to find out where the pain's coming from. So we check different joints to see if they reproduce any of the symptoms. And by reproducing the symptom, by doing each test, we know where it's coming from. So then we know where to treat in the future. And usually we go through we have a little feel with our fingers to find where the joints aren't moving as well as they should be. There's some research done on cadavers, so dead bodies, with chiropractors adjusting the cadaver's neck, and it's shown that I'm pretty sure it was virtually impossible to cause any serious damage by doing the chiropractic adjustment, to break the neck. Whereas when we see those films about Jean-Claude Van Damme smacking necks, we're like a silent laugh to ourselves almost. There are risks associated with the neck adjustments for people who are vulnerable, but to actually break a neck like Arnold Schwarzenegger, it's virtually impossible. There's a fair bit of difference when you're staff, when you're working for someone, so like a employee, you'll come to work, you'll do your work, and then when you leave home for the night, that's it, you're done. Whereas when I come to work, I'll do my work, and then I'll go home, then I'll be like, right, I need to pay this bill, do this advertising, write up these notes, write up these letters. So I feel like being the owner, even though it's a lot more rewarding, it's a lot more hard work as well. I definitely prefer having my own saying what to do rather than somebody else telling me what to do. But I'm really proud of what we've achieved here in such a short period of time, and I would like to replicate this place and all its good bits and open several practices in the future. And as I said then, by opening several practices, I want to be able to help as many people as possible to live like their best life almost. And breathe in and breathe out.